I've got a big episode for you today as I talk about what to do if you're scared of dogs jumping up and what we can all do as dog owners to help people who are scared of dogs. I'm then going to move on to the best way to treat a dog with a slipped disc, which is a really big topic, before then moving on to when to spay your female dog, along with the risks and benefits of having this procedure carried out. But before we get into all that, here's the intro.
Welcome to Call the Vet, the show that answers all your dog and cat questions so they can live healthier, happier lives. And here's your host, veterinarian Dr. Alex Avery.
Hi and welcome to episode 28 of Call the Vet. I'm Dr. Alex, the veterinarian behind ourpetshealth.com, and my aim on these podcasts is to give you the information that you need to help you look after your dog or your cat to the best of your ability. And I'm really grateful that you're here sharing your valuable time with me. I know there's loads of other things you could be doing or listening to, so I'm really grateful that you're choosing to tune into this show. And if you do enjoy the episodes, then make sure you're subscribed to the podcast so you don't miss out on any future episodes at all. And you can also get your question answered to be featured on an upcoming show simply by heading to callthevet.org. And if you head over to that website as well, you'll find links to kind of all the show notes, all of the resources, and all of the information that I talk about in these podcast episodes. And so my first question was sent in by Roblox, who writes, I'm going to my friend's house tomorrow and she has 4 dogs, 1 little, 2 medium and 1 big. How can I stay calm while the dogs are jumping up at me? Because I'm scared of dogs that bark and jump up. I've been there before and got over it, but I feel even more nervous than ever. Please, could you help? Okay, so this is a really important topic for every dog owner to be aware of, because a fear of dogs is actually very common, and there's not necessarily a rational fear. It could be a fear of dogs of any size, so the smallest dog right through to the biggest. And actually a fear of dogs, it does affect about 9% of the population. So one in every 10 people effectively is scared of dogs. So, that is really common. Now, that's not necessarily going to be a crippling fear of dogs, but, if there's any kind of nervousness, then it's up to us as our dog's owner to keep our dogs under control and to make sure that any person who's scared is made to feel as comfortable as they can and not subjected to any unnecessary distress. So in the first case, I'd simply say to Roblox to speak to your friend or family member who has the dogs, and this is the same for you if you've got a slight fear of dogs. You might be a cat person and you just really, you're not comfortable around dogs. So, if you're going to visit people, then you've got every right to be as comfortable as possible. So you can ask them, can they exercise the dogs beforehand? They'll be tired. They maybe be less excitable. They'll have less energy to burn, and so are going to be less likely to jump up on you. Can your friend or your family member just shut the dogs away when you arrive and only bring out the calmest dog, when you're comfortable or if you're feeling comfortable? So I think if they want to see you, they should really be respecting, your wishes and your fears and trying to make life as easy as possible. Now, if you are meeting dogs or if you're going somewhere and, you haven't felt comfortable to say anything, or you're just feeling, not happy and dogs are jumping up, then just stand tall if you cross your arms. So have them folded across your chest rather than dangling down. There's less likely of the dog kind of nuzzling you and maybe you'll think they're going to, bite you. Kind of make a fist as well, not to hit the dog or anything, but just it means your fingers aren't wiggling around and you're not going to be waving your fingers in the air, and an excited dog could take that as wanting to play. So stand tall, cross your arms, have a wide stance as well, and maybe be side onto the dog, because that way you're less likely to get knocked over, so you're going to be more able to stay on your feet. And that's especially important if there's a big dog jumping up. So if you've got a big friendly Bolshy Labrador or a German Shepherd or Retriever or whatever, then they've got quite a lot of weight and power behind them, so you don't want to be knocked over, because while they're unlikely to do anything, assuming that it's a friendly dog, of course, that's going to really make you panic, and that's what we don't want to happen. So you're standing tall, crossing your arms, wide base stance with your legs. Don't look at the dog in the eyes, because that kind of can encourage them. And certainly if there is a dog that isn't as friendly, then actually staring at their eyes can be quite a confrontational signal that you're sending to them. So don't look at them in the eyes. Stay nice and quiet. Try and calm yourself just by asking your friend to hold their dog breathe deeply and breathe slowly and just try to ignore them. So don't shout at them, don't scream, don't jump up and down, don't run, don't start waving your arms madly around or your hands madly around, because that's just going to excite a dog. Even if it's super friendly, that's just going to excite it. That's going to be more interaction and it's going to probably make them jump up more. So that's what you can do if a dog is jumping up. But how can we get over our fear of dogs in the kind of ultimately is that's what we want to be aiming for. Now, it might not be possible for you to completely get over your fear, but you want to be more comfortable, especially if it's a dog that's owned by your friend or your family member and you're going to be interacting or going around to their house on a pretty regular basis. So the first thing I'd suggest is to try and analyze the situation. Why are you scared? What are you actually scared of? Is it a particular situation? Is it a certain breed? Is it a certain behavior? So like in this case, is it just jumping up? Are you actually comfortable in other situations where dogs are around? Yeah. Is it certain breeds? Is it sizes of dogs that are more worrying than others? And that will just allow you to help trying to kind of understand the situation and take control and learn what to avoid and where, maybe you need to take steps to try and correct that. Now, the next thing I tend to recommend is learning to read a dog's body language. So dogs are actually really good at letting us know how they're feeling. Are they comfortable? Are they friendly? Are they just wanting to play? Are they getting nervous? Are they getting anxious? Or are they even kind of winding up to get aggressive because we've not been recognizing their signs kind of leading up to that moment? So it's actually very common that people don't really understand what a dog is trying to say, and there's a number of different resources available, books and videos and that kind of thing, just to help you learn to read your dog's body language much better. And that's going to make it more comfortable, because if you understand that their ears are up, they're pointing forward, they're kind of panting, they're happy, they're looking kind of nice and relaxed, and they're looking like they're wanting to play, you're going to be much better able to accept that they're not a threat, and so hopefully feel more comfortable. The next thing I'd say is control the environment and take things slowly, just setting yourself up for success. So if you know that there's a certain dog breed that you're worried about, or a certain size dog that you're worried about, then really just try and control the environment and try and remove those individuals from the area that you're in, and then you can start to try and desensitize yourself. So you can start with these dogs far away, maybe it's the other side of a playing field or something like that, and then you can move to have them on the other side of a big room, slowly moving them closer, but taking it a very slow step at a time, so that each step you're still comfortable. You can then start interacting with them, but do it in your terms, not on their terms or not on your friend's terms or anything like that. And then just practice makes perfect. If you're scared of dogs and you're trying to get over that fear, then you're going to have to come into contact with them regularly. Now, that might be, like I say, just on the far side of a playing field to start with, but doing that regularly, practice makes perfect, and that's absolutely the case here as well. And then the final thing I'd say, depending on how scared you are, is just to seek professional help, just so that you can get a really good idea of what it is that has triggered that fear in you, maybe help you understand it better, and also just seeking professional help and advice to get over that fear of dogs. And then just before I jump into the next question, I wanted to let you know that this podcast today is brought to you by my Summer Dog Care Guide. So this is my free ebook that runs through the signs of heat stroke in dogs, how to cool your dog down quickly if they are overheating, how to keep them cool in the first place, how to avoid some of the other summer dangers that they might come across. So you can get your free guide today just simply by heading to ourpetshealth.com/summerdogcare, and you can enjoy the summer, enjoy the hot weather, safe in the knowledge that you're keeping your dog as safe as possible. And so my next question is from Hold Me Back, who writes that their Cavalier King Charles Spaniel is suffering from discoordination, and she's only not quite 8 years old. So the vet said to take her to a neurologist, but the specialist recommended an MRI that was going to be, multiple thousands of dollars, which we cannot afford. I'd be so happy if this was all it was. The specialist is talking about a potential operation, if it's a disc problem, that's going to cost about $10,000. So that's a huge amount of money. The dog's on prednisone at the moment, but weaves in and out of being okay and not okay for weeks now. Are there tests to confirm this before having to resort to an MRI? And is surgery the only effective treatment? Okay, so it sounds from the description here that this dog is suffering from intervertebral disc disease, which we would also know as a slip disc. So you've got the bony bits of the spine, so the vertebrae, and in between those bony bits we've got what we call intervertebral discs. So we can think of them as the shock absorbing mechanism of the spine. And if they kind of protrude and start bulging into the spinal column where the spinal cord runs, then that can cause kind of some severe neurological problems, which I'll come on to in a minute. But that's what we would know as a slipped disc. So slip discs come in a range of severity and clinical signs, so things that you're seeing in your dog if they're affected by this. And that's reflected in a grading system. So we can grade things 1 through 4 or sometimes 1 through 5. And grade 1 is there's spinal pain only. So there's no problem with the function. The dog's walking fine. There's no weakness or anything like that. But they have got a sore back effectively. Now, if we move up to stage 2, then that's pain with muscular weakness as well, and loss of normal nerve function that results in a loss of normal perception. So we start to see problems with the dog moving. They're getting weak in their back legs. It can be their front legs as well. It can be their front and back legs as well. And this is going to depend on actually which disc is affected. So is it a disc up in their neck? Is it in their kind of above their chest? Or is it kind of in their abdomen, kind of the back of their spinal column? So depending on that depends on which legs are going to be affected. But we start to get weakness. We start to get kind of the legs crossing over, maybe a lack of other reflexes that your vet will test. They might start dragging their back legs, kind of scuffing the tops of their feet as they're walking. Now, if we go on to stage 3, then we get muscular weakness, but actually they're very weak. They're unable to stand and unable to walk. There's still some movement in their legs, but that movement isn't enough to get them standing up and to get them moving. And they may also actually develop urinary retention at this spot. So they may be unable to pee, and their bladder may get bigger and bigger and bigger. Now, once the bladder gets to a certain size and becomes completely full, then you will start to get a drip of urine. So if you're seeing that doesn't mean that they're necessarily peeing okay. It could just mean that their bladder is very, very full. So if your dog has got a slip disc and they're unable to move, then there is a chance that they're going to be unable to pee as well. And that is something that we're going to have to consider when it comes on to managing dogs with this severity of disease. And then moving on to stage 4, that kind of comes in 2 flavors, if you like. So stage 4 is paralysis with definite urine retention, so that limbs are unable to move. They're unable to move their legs at all. Now, with stage 4A, they still have sensation. So if you squeeze their feet, sometimes you have to squeeze their feet really hard, they're still going to be able to feel it. And then we move on to stage 4B, or sometimes that would be called stage 5, and that's where we get a loss of sensation. So no matter how hard you squeeze their feet, even if you take forceps or some, pliers, I wouldn't recommend do that, but your vet may test it with forceps by squeezing their toe. Even then, they're not feeling it, and we call that a loss of deep pain, and that is really bad for the prognosis of recovery, especially if we're not able to go for surgery, which I'll come on to in a little minute. So how do we go about diagnosing this problem? Well, a clinical examination is going to be the first thing. So if we're only dealing with a case of back pain, it may be that your dog's a little bit tender along their back, but there's not very much else for your vet to see, to notice, because they're able to move fine. There's no change in their reflexes. Their nervous function is completely normal. But a clinical exam is very important because it might show that there is a nervous problem, that your dog is starting to scuff its feet, that there are numerous other reflexes that your vet will test that are inappropriate, that will give a really big clue that there is a problem with the nerves, and that can very well be narrowed down to the back. Now, is it an appropriate breed? That's an important thing as well. So, for example, Dachshunds, Beagles, Cocker Spaniels, Shih Tzus, Pekingese, Lhasa Apsos, Pugs, French Bulldogs, Welsh Corgis and Poodles are all predisposed to this problem. Dachshunds especially, they're the classic breed that unfortunately all too often suffer from slip disc, from intervertebral disc disease. But if your dog is one of those other breeds, then again, the index of suspicion, the likelihood of a bad back and a disc problem is going to be higher. Now, x-rays are something that can be used, and they can be very useful. So if your vet is taking x-rays of your dog's back and they're seeing a narrowing of where that disc would normally be. So if every other intervertebral disc space, and when we're taking x-rays are really good at looking at bones. They're not very sensitive at looking at kind of more soft tissue structures because the x-rays pass through that and you get very little detail. But if you're looking at the space between the bones of the spine and there's one space that's an awful lot narrower than the others, then that would be, an indication that that disc space has collapsed and there's a likely problem there. You can also get calcification of the disc. So as the disc becomes old and dried out when there's a problem, then it becomes calcified. So it becomes denser or whiter on an x-ray, and that can be a sign that there is a problem with disc disease. But unfortunately, in many cases, when there is an intervertebral disc problem or when there is a slip disc, x-rays are really not very accurate and they can look completely normal even when there's an awful lot of problems going on in a particular area. And so we can look in different ways to find out what's going on. So before MRI or CT scanning became widely available, and even now it may not be available in your area, or maybe extortionately expensive, we did something called myelography. Now, myelography involved injecting what we'd call a contrast medium actually into the space around the spinal cord. Now, this contrast medium is something that shows up bright white on an x-ray. And where there was a compression of the spinal cord, you'd get a thinning of that contrast material, and that would give an indication of where the problem was. So it's a pretty good way of doing it, but it does carry a risk of causing seizures. It can be quite complicated to get, quite technically demanding to get a good picture. And by and large, in a lot of places, it's been superseded by MRI scanning. So MRI is excellent for this. It's very accurate, and you can tell if there's a problem in multiple areas or if it's just a problem with one disc. So by and large, MRI is definitely the best way to diagnose that an intervertebral disc extrusion is the problem going on in any dog. Now, once we've diagnosed the problem, either through clinical exam and that kind of thing and x-rays, or through advanced imaging with MRI or even CT or myelography, there's a couple of different ways that we can manage these dogs. So the first one is conservative management, and then the other option is surgical management. So surgery, it involves opening up the spine. It involves scooping out, removing that disc material and stabilizing the vertebrae. So clearly, spinal surgery is going to be quite invasive. It's a technically demanding surgery that's not going to be carried out by every general practitioner by any stretch of the imagination. It tends to be carried out more by specialists or those with a really serious interest and a lot of experience in surgery. Now, it's better done as quickly as possible, especially if we're dealing with the higher grades, the worse grades. If actually we're dealing with a case of 4B or 5 where there's a complete loss of sensation along with the paralysis and urine retention, really ideally we want to be operating on those dogs within 24 hours. And even then the prognosis is a little bit hit or miss, but ideally we want to be going in within 24 hours. If the severity is not quite so bad, then there is a bit more time available to us. But if we're going to go for surgery, then really we want to be making that decision sooner rather than later. And surgery doesn't mean that once that's done, everything goes back to normal. A dog will still need to be completely confined for about 4 weeks post-surgery, just to allow everything to heal up, to stabilize, and to reduce the risk of any complications or further nerve damage. Now, if instead of surgery, we're going for conservative management, and that's completely appropriate depending on what level of problem is, then that's going to be a long-term commitment as well, where we're going to need pain management for an individual and strict confinement. So that really means to a small crate where they can have some food, have some water in, but not do much more than that. They need to rest as much as possible, and they need to do that for about 4 to 6 weeks at a very minimum. Now, this is absolutely appropriate for levels 1 and 2, so when there's just spinal pain or when there's a little bit of muscular weakness, a bit of loss of nerve function, but the dog is still able to walk, is still able to move. Conservative management is absolutely fine. But if things are worsening, so despite that confinement, a dog is becoming weaker or their nerve function is deteriorating, even if they're still able to walk around, then we should be thinking again of kind of switching over to surgical management. So other things that we can do is we can use a harness rather than a collar, especially if the neck area is affected when we're taking up our dogs out to walk, to go to the toilet, that kind of thing. We absolutely don't want to have them to have free exercise at any point of time. They always need to be on a lead, but taking them out to go to the toilet, if you've got a smaller dog, actually carrying him or her out to go to the toilet is going to be ideal, but they're going to need to be on a lead at all times, just to make sure that they don't see a cat and decide that they're fine and try and chase after it, which could be disastrous. We also, if your dog isn't able to move around themselves, then you're going to need to keep them in a well padded, clean area just to help prevent ulcers. You're going to need to try and keep them clean to prevent urine scalding. You're going to need to bathe them as needed, and if they do have a loss of conscious urination, so if they do have that urinary retention that I talked about, where the bladder is going to get really, really big and then start leaking, then you're going to need to manually express that bladder. 3 to 4 times a day is generally kind of a good starting frequency for that. Physiotherapy is also going to help with joint and muscle function, just keeping the joints nice and loose, so they're not stiffening up, to try and kind of keep that muscle mass, because otherwise they're going to lose a lot of muscle just through disuse because they're needing to be kept so quiet. And then finally, non-ambulatory animals, so those that aren't able to walk around, they really shouldn't be allowed to drag themselves around, because that's just going to cause other injuries, cause skin problems, where they're getting erosions and ulcers on the tops of their legs or their feet, and they also might kind of cause or exacerbate their spinal damage. Now, pain management is crucial, obviously, when it comes to either surgery or during conservative management, and there's a number of different options here. Now, I guess one of the big debates is whether we give steroids or whether we give non-steroidal anti-inflammatories, and it actually seems that the non-steroidal anti-inflammatories may be a better choice regardless of severity. So that's kind of the latest thinking that I'm aware of, although in some cases steroids may do a very good job as well. We can use something like gabapentin for the nerve pain, so that's really good for what we call neuropathic pain, which is pain kind of originating in the nerves. We can use opioids like morphine, buprenorphine, or even topical fentanyl. Now, that's going to vary depending on licensing. There's a variable availability of that, and that does, these are drugs of abuse as well, so they're generally not things that can be dispensed. They're things that are used in a hospital setting. So if your dog is hospitalized with their veterinarian, then there's a good chance that they'll be getting opioids, just to make sure that they're as comfortable as possible. So something you need to know to be able to decide which treatment option is best for your dog is, what's the prognosis? So if we start with surgery to start with, if you've got a dog who isn't able to walk, they may have some movement, they may be completely paralyzed, but they are able to feel their legs, then actually with surgery, the recovery is over 90%. So that, that's still a really high recovery. Now, that's not to say that every animal is going to respond completely, of course not. Unfortunately, 1 in 10 dogs is therefore not going to respond and not going to benefit from that surgery, but 90% is a pretty reasonable prognosis to my mind in what is a really serious condition. If, however, you've got paralysis with loss of sensation, then that recovery drops to about 60%, but it's really variable and really highly time dependent and hard to predict which individual dog is going to benefit more. If you're operating within that 24-hour period of them going off their legs and losing their sensation, then the prognosis does seem to be better, but even then it's not as good as the severity being not quite so bad. So loss of sensation really can be a very bad prognostic indicator, if you like. Now, that's surgery. If we move on to conservative treatment, like I say, that was very appropriate for stage 1, grade 1 or grade 2. So that's when either there was only spinal pain, or when there was spinal pain, a little bit of muscular weakness, and maybe some neurological problems. But if we're moving up, we're going to grade 3. So there's still movement in the legs, but your dog is not able to stand and to walk around. Then actually that carries a prognosis with about 80% recovery. So, it's not as good as with surgery, but 80% is still pretty reasonable. Now, if you move to grade 4A, so that's when there is paralysis, but there is conscious pain, so they're still able to feel, then conservative treatment will result in an improvement in about 60% of cases. So, yeah, that's more often than not, but there's still a reasonable proportion or a very high proportion, so that's 4 out of every 10 dogs or 2 out of 5 won't get better with conservative treatment alone. So that's one of the reasons why, really, if you're stage 4A, 4B or 5, then surgery definitely is much, much better. So remember, so with 4A, if you're conservatively treating them, the recovery is 60%, but if you're surgically treating them, it's over 90%. So there's a really big difference there. And then if you're getting this loss of pain perception, then with conservative treatment, only about 10% of dogs will recover. So it's really, really poor. Now, assuming that the treatment goes well, whether that's surgery or conservative treatment, there is unfortunately a recurrence rate. So about 6% of dogs will have a recurrence with signs, and that's because either there's a problem within that same disc, especially if we're conservatively treating, that same disc space then goes on and causes a problem at a separate date, but it could be that there are multiple discs involved and it's just another one of those goes. So about 6% of dogs will have another problem. That is higher, unfortunately, in the Dachshund, which, like I said at the beginning, is a breed that is really susceptible to this. So, that's some of the things that you need to think about when it comes to, how we diagnose this in the first place, because that diagnosis can be tricky in some cases, and then whether surgery or conservative treatment is best for your dog if they do suffer from a slip disc. And then just remember that the information that I give in these podcasts is not a substitute for a consultation, an examination with your pet's veterinarian, and should not be taken as specific advice for any individual pet. If your pet is unwell, if they're injured, or if they're suffering from any kind of problem, then talking to your vet is always going to be the best course of action.
Get your questions answered at callthevet.org.
So I did warn you at the beginning that treating a slip disc is a really big topic, but, it's a condition that can come out of the blue. So even if, that's not something that's on your radar, hopefully listening to this will help better prepare you should that happen to your dog. Hopefully it won't, but if we're aware of all of these things, we're going to be better able to cope in a crisis because they can come on very quickly. But anyway, my next question is from Monira, who says, I have a golden retriever and I'm having a tough time deciding when to spay her. She is currently 8 months and is almost done with her first heat cycle. I'm worried about things like cancer, bone development and other things. I also just wanted to know your opinion. Okay, so the traditional dogmatic view that all bitches should be spayed at around 6 months of age is really kind of being called into question, and the last few years has seen a big increase in the amount of information, the amount of data about the risks and the benefits of spaying. So if we start with the benefits of spaying your dog, well, there's a reduction in mammary cancer. So if we're spaying before the first heat, so around 6 months of age, so the first heat typically is around kind of 8-9 months, as is the case in Manira's dog. If we're spaying before then we reduce the risk of mammary cancer by about 99.5%. So not completely, but, near enough. If we're spaying before their second season, we reduce that risk by about 95%, and before their third season by about 75%. Now, if we're spaying later than that, there's probably still a small benefit with reducing the severity of any mammary cancer or the survivability of any mammary cancer that develops, but it's not nearly as marked as if we're spaying in kind of that first kind of 3 heat cycle period. Now, the other benefit is pyometra. So pyometra, if you don't know, is an infection of the uterus, and the uterus becomes like a big balloon filled with pus. Can't be treated with antibiotics successfully. It generally needs, or the best treatment is generally surgical removal, and it is an emergency procedure. It does carry a risk of death. So about 5% of dogs who suffer from pyometra, even with appropriate treatment, will die. If your dog isn't treated for pyometra, if they don't have surgery or medical treatment, then they will die. It's a really serious condition, and about 1 in 4 entire female dogs will develop a pyometra by the time they get to 10 years of age. So it is a really common procedure there. Now, other benefits, there's behavioural benefits. So it reduces roaming. So your dog kind of trying to break out, trying to find a mate and have babies when they're on heat. And actually, there's a big risk of being hit by a car, having kind of going onto the road and being knocked over in dogs that roam. So, there is actually a kind of a big safety benefit to stopping that, through either good fencing and, being well contained, or by neutering your dog. If you've got if there are sexually transmitted diseases such as brucella or transmissible venereal tumour, which is also known as TVT, in your area, then spaying is going to help kind of reduce the risk of those being transmitted to your dog. Now, they are not diseases that are found across the globe, but your vet will be able to advise you if they are concerns or there are risks for your dog if they go unspayed. And then the other big benefit is spaying reduces unwanted pregnancy, which is beneficial in two senses. So pregnancy itself isn't risk-free. There's a risk of cesarean sections, which comes at a big cost, and various other complications, eclampsia, so low calcium levels, various other things. Also, it's not always as easy to rehome puppies as you think it might be. And unfortunately, puppies that either can't be rehomed or rehomed to inappropriate families or inappropriate people who are unable to cope with them because of their living arrangements, maybe the breed and the size of your dog, that kind of thing. If they make their way into the pound or into the shelter, then there is a significant chance that they will be euthanized even if they're healthy. So that's something that I've spoken about several times, and I'll link a kind of one article in particular I definitely think that every dog owner needs to be aware of, regardless of whether their pet's spayed or not. I'll link that in the show notes, so make sure you check those out, and you can head to the show notes at callthevet.org. Now, so those are the benefits, the big benefits of getting your dog spayed. But like I say, there are risks. So any surgical procedure, any anaesthetic comes with a risk. Now, those risks are really small, but we can't say there's no risk at all. Spaying is a routine procedure, so it's one that your vet is likely, very, very comfortable performing, but very, very low risk isn't zero risk. So that's something that obviously you need to be aware of. There is a risk with obesity following surgery. So by removing the ovaries, by removing the hormones, we reduce the energy requirements. We increase the risk of fat being laid down. So you need to be mindful of that, to feed your pet appropriately, feed your dog an appropriate amount, and also make sure that they're exercising to keep their muscle mass and to stay nice and fit and healthy. Another risk is the risk of urinary incontinence. So it was up until recently thought that was more of a problem in female dogs that were spayed when they were very young compared to when they were spayed at an older age. But actually, a recent study that's looked at a really large number of dogs suggests that isn't the case, and that actually spayed dogs, full stop, are 3 times as likely as unspayed dogs to develop urinary incontinence. And so the age of spay doesn't actually make much of a difference. At least that's the thought with the more recent studies. So, that's definitely something to consider as well. Cruciate ligament disease is another thing. So this is where we come on to joint problems and bone development and that kind of thing. So cruciate ligament disease, there was an increased risk. I'll start again. There's been a number of different studies that looked at specific dogs, and the message is mixed, really. So there's an increased risk of cruciate ligament disease in German Shepherds that were neutered before 12 months of age. In Golden Retrievers that were spayed before 6 months of age, again, there was an increased risk of cruciate ligament disease, but there was no difference in Labradors in cruciate ligament rupture, regardless of when they were spayed or whether they were left entire. So you can see here that there's quite different messages for dogs that are all big breed dogs, and in the case of Golden Retrievers and Labradors, actually very closely linked dogs. So it's quite hard to make general rules and generalizations when we've got such mixed messages. Now, with hip dysplasia, some dogs seem to be at a higher risk of hip dysplasia, and labs specifically that were spayed under 2 years of age seem to be more at risk of that. And then with cancer, so remember, we've got the benefits with mammary cancer of reducing that, and mammary cancer is a really common disease in older entire dogs. But cancer, so with labs and retrievers, there may be an increased risk of lymphoma in those spayed between 6 and 11 months, but it's not really a consistent finding. So again, we've got quite mixed messages when we're looking at incidence of cancer in spayed versus unspayed dogs, when we're looking at different breeds. And so making generalizations is really hard. And, we all love to make generalizations. It would make my life a lot easier because I could give you, definite rules. But in the reality, the reality is there's lots of shades of grey. There's not very many situations where there's real black and white answers. it would be great to just apply a new finding to every breed of dog of every size. But, with some of the studies that have been run, with a lot of the studies that have been run, we just really can't do that. And anyone who is saying there is definitely an increased risk of this or there is no chance of that really isn't telling you the full story. They're making their own assumptions and probably incorrect assumptions, and not letting you kind of digest the facts and make a decision that's right for you, and that's right for your level of risk that you're happy to take on, and maybe kind of deals with the individual nature and history of your dog as well. And so that means really that, there's one thing that is clear, and that's what's right for one individual may be wrong for the other because of the breed that your dog is, because of the different, risks that you're comfortable of living with, and also the different resources that are available to you. So you shouldn't really feel under pressure to make the right decision, because really there's no such thing. Some people might choose not to spay, and they're going to be quite happy to, keep a close eye out for signs of a pyometra and act if that does occur. And they're going to be more than willing and more than able to afford any emergency surgery that their dog needs. They also may be happy to have any number of mammary masses removed as soon as they appear, again being completely able to afford that. But if an emergency pyometra surgery or mammary mass removal is going to be unaffordable for you, then what potentially may be a curable condition is actually uncurable for your dog in your situation. And there's nothing wrong with that. That's the reality. Unfortunately, some of these things, they do cost a lot of money. They involve a lot of expertise, they involve a lot of personnel and a lot of equipment to cure. And so as a result of that, they understandably can cost quite a lot of money. If we're carrying these procedures out in the middle of the night, in the case of a really bad pyometra, then, understandably, that's going to be even more money. So if those things are going to be unaffordable and they're all common conditions in unspayed dogs, then actually spaying your dog is definitely going to be the best thing. Also, if you're not able to keep your dog locked away when they come on heat, if there's a chance that they're going to get pregnant and develop an unwanted pregnancy, especially when they are younger, and we don't want them getting pregnant in their first heat because they're not mature enough, they're not skeletally mature enough to carry puppies safely. It's not really fair on them. Then again, we should be thinking of spaying them earlier, even if that maybe isn't the ideal situation given their breed. So what are my thoughts on kind of all of this? Well, my thoughts are that for small breed dogs, I would still definitely recommend spaying when they're around 6 months of age, before their first season. So we're getting all of the benefits, and small breed dogs don't seem to develop some of these problems with cruciate ligament disease or hip dysplasia that maybe the larger breed dogs. And so for larger breed dogs, then I'd say that if there is no risk of them becoming pregnant and where they can be successfully managed while they're on heat, then I generally recommend delaying this operation until they reach 1 year of age or a little older. So that's my feelings, but like I say, there's no right answer. And so what I feel is the general rule may not be right for everybody, and absolutely feel free to make up your own mind. I've got all of this information written down in a blog post, and again I'll link that into the show notes because there's quite a lot of information here, and in that article I've also got information about other breeds of dogs. So regardless of what breed of dog you've got, if you're thinking about getting them spayed, definitely head over to the show notes and check that article out. And so that's it for this episode of the show. I hope you found it interesting. There's a couple of big topics that I've covered. So there's a lot of information. If you've got any questions about it, then head over to the show notes and just leave me a comment there, and I'll try and get you the information, or I'll try and clarify things a little bit better. You'll also find links to all of the other kind of blog posts, the other resources that I've mentioned in today's show. Now, if you have enjoyed it, then make sure that you're subscribed so that you don't miss out on my future episodes. And remember that as well as all of the links and everything that I talk about, if you head over to callthevet.org, you'll also be able to leave your question so that I can answer that on an upcoming show. But that's it from me, and until the next episode, take care.
You've been listening to Call the Vet. Be sure to rate, review, subscribe, and we'll see you on the next episode of the show that answers all of your pet questions.